All right, let's finish up talking about immune system disorders. Let's pick up with immunodeficiency disorders. If you remember, there are two categories of immunodeficiency disorders. We have primary and secondary. For primary immunodeficiencies, these are results of genetic or naturally developing conditions, and they can impair either the innate or the adaptive immune response. If we are talking about the innate immune response, we could be talking about impairing something like complement proteins, which we haven't really talked a whole lot about complement proteins. These assist with the innate immune response. There's quite a few different parts to the complement system, so we could be impairing any number of those parts. Or you could have abnormal phagocytes. If you remember, hopefully you do, phagocytes like to eat things like foreign bacteria, things like that. So you could be you would be at a higher risk of developing bacterial or parasitic infections, and this would make it harder for you to fight those infections. Now, if you are instead impairing the adaptive immune response, you could have something like hypogammaglobulinemias, which is really hard to say. It's also kind of hard to spell, so I'm glad I'm not going to give you a spelling test. You're welcome. This results in the decrease or the deficiency in one or more types of antibodies. So if you remember, we do have 5 different categories of antibodies: IgG, IgA, IgM, IgE, IgD. Okay. And if you don't remember quite what all those do, don't be afraid to look back at previous lectures that cover what each of those do specifically. But having a deficiency in one or more of these is going to increase your risk of infection, and it's going to make it harder for you to fight off your foreign invaders. You could have a much more severe primary immunodeficiency. It's known as severe combined immunodeficiency, or SCID. And there are different forms, kind of different severities of SCID, but they basically all stem from the failure of the lymphoid cell lines. Now, lymphoid cell lines are your B cells, your T cells, could even affect your natural killer cells, things like that. So again, your adaptive immune response. These low levels of your lymphocytes make it really hard to fight off specific antigens, okay, specific invaders, specific pathogens. It basically leaves you without a cell-mediated immune response, okay, or an antibody-mediated immune response as well, since this can also affect your B cells. Sometimes this is known as bubble boy syndrome, and you can see in this picture, this little patient is basically in a plastic bubble. These people that are affected by this condition, they really don't have much of an immune system at all. So even the smallest cold, anything could really turn into something very detrimental to them. And so oftentimes they are actually isolated from the entire world. They live in a sterile environment. They do have gene therapies trials that are going on. We are seeing some progress, but to my knowledge, as of this recording, there's no cure for this condition. Now, secondary immunodeficiencies, there are many types of these. This part sounds weird. Some are intentionally induced to combat cancer or prevent transplant rejection. So sometimes we give this to people on purpose, which again sounds a little crazy. But if you're fighting cancer or if you want to prevent transplant rejection, it's making a little bit more sense. This could also be caused by a couple of other things. You could have cancer of your immune cell line or your lymphoid organs. This would depress the immune response. Okay. You could also have a viral infection. So the most well-known and also the most common cause of secondary immunodeficiencies, HIV, human immunodeficiency virus, which leads to AIDS, acquired immunodeficiency syndrome. So the HIV virus spreads through contact with infected body fluids, and that can be anything from blood to semen, vaginal fluid to breast milk. And what's really going on when you suffer from the HIV virus is your T helper cells are being destroyed. And hopefully you remember that your T helper cells help activate and stimulate several other immune cells in your body, including B cells. So if we wipe out your T helper cells, it makes it a lot harder to activate those other components of your immune system. Now, last but not least, we've got autoimmune disorders. Your autoimmune disorders are going to be the result of populations of self-reactive T cells or B cells, okay, that secrete autoantibodies. Okay. These are going to bind to self-antigens. And so your body basically starts to attack itself. Okay. So what should be familiar to your body is no longer familiar to your body. And when it's not familiar, we attack it. Okay. We've got several different examples here. First of all, we've got multiple sclerosis, commonly referred to as MS. This, they think, occurs because self-antigens that were not previously encountered by T cells may trigger the destruction of these self-antigens. So that's kind of hard for us to think about that. But basically you have these self-antigens that your immune system has just never seen before. And then something happens and those self-antigens are now encountered by your T cells. But since your T cells have never seen them before, they think they're foreign. And so they start attacking them. Ultimately, what ends up happening with multiple sclerosis is the myelin sheaths surrounding your nerve fibers are destroyed. And this interferes with your nerve impulse transmission. One of the most common symptoms of MS is a progressive loss of muscle function because those muscle movement signals just aren't getting to where they need to go anymore. Now, rheumatic fever, that one's not really something you hear about a whole lot, but it's interesting how it works. So sometimes viral antigens or bacterial antigens look really similar to human antigens, and they can activate T cells. But since the foreign ones look so similar to the human ones, the T cells start to attack both the foreign and the self-antigens. So again, we don't hear a whole lot about rheumatic fever. I just think it's kind of interesting that the viral and bacterial antigens look very similar to ours. And so it's almost like the T cells can't really distinguish between the two, so they just attack everybody. Then we have type 1 diabetes. Okay. This occurs when your immune cells destroy the insulin-producing cells in your pancreas or your beta cells in your pancreas. Hopefully you remember that insulin helps us lower our blood sugar after we eat. And then if we don't lower the blood sugar, the sugar stays in the blood. It's not super useful there, and it can actually cause a whole lot of problems. And so people with type 1 diabetes usually have to take insulin shots, or they'll wear insulin pumps, things like that. So we make sure that they have adequate amounts of insulin. That way your blood sugar can stay nice and regulated, and we have enough energy to fuel our bodies. Now the next one's a little bit of a mouthful too. Systemic lupus erythematosus, or SLE. Really most commonly just called lupus. Okay, so if you've ever heard of someone with lupus, this is what we're talking about. Now, we are not 100% sure what causes lupus. We think it's probably caused by pathogens that produce cytokines. Okay, so hopefully you remember what cytokines are. And these are produced to non-specifically activate B cells to produce antibodies. Okay. Or excuse me, autoantibodies. That's kind of the important part there. They're autoantibodies. Okay. So you're having this pathogen secreting these cytokines. We're activating B cells to produce autoantibodies. Those autoantibodies are then attacking our own bodies. There are, so systemic lupus refers to the fact that there are a lot of different body organs and body systems that are affected by lupus. So it's not just one organ, it's not just one body system, it's kind of your whole body. And then we have rheumatoid arthritis, or RA. This one, your immune system starts to attack your joints. Your joints get really stiff and inflamed. Anybody who suffers from really, really severe rheumatoid arthritis, if you look, usually the hands are the easiest place to see it. But if you look at somebody's hands with RA, their fingers can literally be crooked because they're just so inflamed that they've become disfigured. And I don't think I have to tell you that that's really painful. And then last but not least, we have celiac disease. This one occurs when your immune system attacks your small intestine, but it only does it if gluten is present. So gluten is our trigger here. Okay. The gluten triggers the inflammation. You also get abdominal discomfort. I'll kind of just think of all the nasty negative side effects of like an upset stomach. But this one is directly associated with the presence of gluten in your diet. So people that suffer from celiac disease, gluten in their diet is basically a big no-no, okay? Because nobody wants abdominal discomfort. Okay? And then that wraps up our discussion of immune disorders.